In other national news tonight, no room in the inn, or rather beds. That was the situation at the Princess Margaret Hospital yesterday when the facility was bombarded with an influx of patients. The country's Minister of Health gave an update on the situation today to our Cleopatra Murphy.
The Princess Margaret Hospital battled what Minister of Health and Wellness, the Honourable Dr. Michael Darvill, describes as an intense backlog Tuesday, with the facility unable to find beds for more than 40 accident and emergency patients. Darvill, however, says the situation is now under control.
Fortunately, our arrangement with Doctors Hospital is still very fluid, and we found spaces there, as well as we had to open another section of one of the wards. But we are working diligently to ensure that everyone who comes in who needs admission is taken care of, and for us to move very swiftly for those who are in a virtual ward and are asking emergency find bed spaces as soon as possible.
In December, he announced officials had negotiated a $2 million deal to transfer patients from the Princess Margaret Hospital to Doctors Hospital as it underwent renovations to the tune of between $2 million to $2.5 million. With the upgrades progressing, Darvill says it has added to the bed space shortage.
There's a bottleneck that has been worked out, and so from time to time, when the admissions rate at the accident emergency goes up, we will have challenges. But we assure the Bahamian people that the contractual agreement that we went into for repairs is somewhere between 14 to 18 months, and we had to ask the general population to please bear with us. At the end of the day, we're going to renovate these wards, we're going to bring more beds on stream, and we're going to improve the working conditions for the patients as well as our physicians and nurses.
PMH officials say they've seen a rise in patients since November, some coming in for non-communicable diseases, with the Minister of Health adding that an increase is expected during winter months. He says the Doctors Hospital partnership has been operating smoothly, with efforts made to defray costs.
We're moving patients back and forth. We're minimizing the cost. We made it very clear that the patients that we move to Doctors Hospital will be low risk, so that the expense to the arrangement is lower. But with that being said, we're constantly working together as a team to ensure that the bed spaces that are not available at the Princess Margaret Hospital, we utilize the facility at Doctors Hospital West until we finish the renovations of both female surgical 1 and male medical 2.
For the Bahamas Tonight, I'm Cleopatra Murphy.